Health is wealth, and a healthy society is said to be a productive society. It is for this reason that the provision of qualitative and affordable healthcare delivery services remains a top priority of Governor Zulum'S administration. The governor has made exceptional efforts towards revitalizing the healthcare system, which, like many other sectors, suffered a serious setback as a result of the unfortunate insurgency crisis. The appointment of urological surgeon specialist with many years of experience within and outside Nigeria in the person of Professor Baba Malam Gana as Commissioner of Health and Human Services had added new impetus to the transformation drive of the health sector in the state. Upon assuming office in July 2023, Professor Baba Malam Gana used multi-dimensional approaches and strategies to reposition the healthcare system of the state in line with Governor Zulum'S 25-year development plan and 10-year strategic policy. Borno State Ministry of Health and Human Services is one of the key ministries that received the desired government's attention to ensure total overhaul of healthcare at both primary, secondary and tertiary levels through various initiatives of the Commissioner. The healthcare sector within the year under review has witnessed massive construction of various healthcare infrastructures such as construction of new general hospitals and renovation of existing ones, in addition to construction of 5 comprehensive primary healthcare centers, as well as recruitment of over 1,500 healthcare providers, with a view to achieving universal healthcare coverage, UHC.
Borno State government, under the leadership of Professor Babagana Omar Zulum, CON, MNI, has been constructing new hospitals and actually renovating them with a view of replacing it in a better way, the ones that we've lost. For example, in Damboa, a new general hospital is being built, and I've recently visited the facility and I've seen that it's in advanced stage. And similarly, the rehabilitation of Gajiram General Hospital is ongoing, as well as Brigadier Abakari General Hospital here in Maiduguri is also ongoing. And this signifies that the secondary healthcare facilities are also in focus by His Excellency in terms of providing health services nearer to the people. We also, His Excellency has, in the last 1 year, recruited 1,500 staff, about 1,000 to the primary healthcare centers and 500 to the hospitals management board. These are doctors, these are, include pharmacists, etc., who will man some of these facilities. Nonetheless, this may not be adequate at all, and that's why the future plan is to build more or train more so that our people can benefit maximally from this process by His Excellency.
This milestone achievement in providing accessible and efficient healthcare services at the rural area led Borno State to be awarded with the best performing state in the provision of primary healthcare in the country. Furthermore, new specialist hospitals are also under construction, as well as dental and eye hospitals in Biu and Mangano, which have reached advanced stages of completion. Professor Baba Malam Gana speaks more on these gigantic projects.
In addition to those general hospitals, there are also specialist hospitals, special in terms of care provision hospitals that His Excellency has started building, and some have reached roofing stage. And for example, the eye hospital and dental hospital in Biu is under construction, and I have recently received advice it's been roofed already, and eye hospital and dental hospital in Mungno is also in advanced stage being constructed.
In the area of construction, renovation and rehabilitation, in order to allow the Ministry for Health for effective, affordable and quality healthcare services to our people. Currently, the construction is ongoing for the new eye and dental hospital in Biu and Mongono to cater for the northern senatorial zone and the southern senatorial zone to allow people access the services of eye and dental care to our people. And then currently this year, the government has established the College of Nursing in 2 senatorial districts, and one in Goza, and then the second one is in Manguno. The project is currently ongoing and already reached appreciable level of completion, almost about 80% completion now. So when completed, we believe the challenge in the human resource for health will addressed.
The construction of multi-billion naira Borno State University Teaching Hospital by Borno State government has made a remarkable progress. The edifice of about 1.5 by 1 square kilometers land comprises 11 mega departments that will provide medical education and training to future and current health professionals, and when completed, it will further strengthen the entire healthcare system of the state.
Yeah, in 2020, His Excellency, the Professor Babagana Omar Zulum, MNICON, did commence the construction of Borno State University Teaching Hospital here in Auno area. And this is now carrying on. We've been hit, of course, by the COVID and followed by the hyperinflation syndrome in Nigeria, which delayed the process. But nonetheless, now the situation is 75% completion. And as a matter of fact, the medical college within the compound where medical students would start undergoing training is actually being completed and will very soon take over the premises.
The third achievement is the ongoing construction of State Teaching Hospital along Kano Road. The government started with only 3 departments. Now, upgrade to almost 7 departments now is ongoing, and the construction is almost around 70 to 75% completion.
Human resource for health is another area where Governor Zulum's administration paid utmost priority, which includes construction of College of Nursing and Midwifery in Goza and Mangano. Is another giant stride taken by the current administration to scale up the skilled human resource for health in addition to provision of scholarship to over 900 Borno indigents.
His Excellency, considering the fact that Borno State has lost 45% of healthcare facilities and human resources, has focused on human resources for health. Construction of schools of nursing and midwifery is ongoing currently, one in Goza and the other one in the northern part in Monguno, where we're seeing a school of nursing and midwifery being constructed, and all these are advanced stage. And as I said earlier on, Monguno is also having an eye hospital and a dental hospital. This really places Borno State in a unique position. There is no state that, as far as I'm aware, in northern Nigeria that can match this armamentarium of having 3 hospitals in each, one hospital in each senatorial district that caters for eye and dental services. And this is, we are very grateful to His Excellency for his vision in this direction. Now, the issue of human resources for health is very crucial and very important because there are 2 issues here. The insurgency has hit us hard and we lost quite a number of our human resources. And the other issue is that what colloquially people call as Japa syndrome, where our skilled manpower go to greener pastures outside Nigeria. In particular from Borno State, we witness people from Saudi Arabia coming to poach our staff and taking them away to Saudi Arabia because of better pay, etc. So in view of this, His Excellency has focused in making sure the number of nurses and midwives that we produce are maximum, and also they can stay back and help our people. For example, last year we witnessed the approval of the number of students being graduated from our College of Nursing and Midwifery here in Maiduguri from 150 per year to 600. We had to do a lot of buildings to be able to accommodate this, and we're grateful to His Excellency. And furthermore, we have His Excellency is currently constructing School of Nursing and Midwifery in Goza and Mongno to bring up the number of graduates so that they can stay back and look after our people. And you may also, your viewers may wish to recall, recently His Excellency dished out 1,000 scholarship to those who want to study nursing and midwifery, either in the state or outside the state. And this is the first of its kind in Nigeria. We're very grateful to Your Excellency for doing this. And this is all because we're so much depleted in terms of human resources for health. And we have been thinking outside the box so that, we can get the required manpower that can go to the corners and crannies of Borno State and work and save lives in the state.
Apart from construction of new health training colleges, the existing ones in the state capital, such as College of Nursing Sciences and College of Health Maiduguri, have also received total rehabilitation and expansion to meet the present demands in healthcare delivery.
Let me start by thanking His Excellency the Governor of Borno State, His Excellency Professor Babagana Umara Zulum. The achievements to the college under his administration is very enormous. No governor has achieved such projects since the inception of this college. There are numerous. Let me start by counting some of them. We have eight block of classrooms. A block of classroom with 8 classrooms, each with 150 seating capacity. We have a 250 seating capacity multipurpose hall. And then he also provided us with 170 laptops with accessories for our CVT center. Then provision of scholarship to 997 students that are drawn from the 27 local governments. And also 100,000 each for every student in this college. This is very unprecedented, and it is the first of its kind, not only in Borno State, even in the nation. No governor has done such a project. Then the scholarship is not only for students alone. Also, 20 nurse educators have been sponsored to go and do their masters in nursing in various sectors of nursing. Then we have provision of 18-seater bus to ease the transportation problems of students to their clinical area. And then provision of lighting equipments in form of solar inverters. And that is why our school is very lighted. Even at night, students can read, and it has enhanced their performance. Then under his administration, the staff of this college, we enjoyed a lot of capacity building in the area of ICT, in the area of improving our skills, and so on.
With the support we have gotten from His Excellency, the college has recorded good performance in most of our national exams. All our programs are external examiners that come to do the exams, and we have recorded tremendous good performances. Like I said, just recently, the Health Information Department had the E-exams, and they scored 76% of this first attempt on E-exams. Initially, we normally do normal exams through writing and so on and so forth, but this time around, they had to change it, and because of the for support we have gotten, we were able to achieve performance in all the courses so far.
maternal mortality rate in Nigeria is on the increase, especially in the northern part of the country. This development remains a source of concern to any serious government. It is against this background that the Borno state government is making holistic approach in making antenatal and postnatal care free in all government hospitals, with a view to reducing mortality rate.
The Ministry of Health is quite concerned about the maternal mortality, meaning the number of women that are dying as a result of pregnancy-related problems, either during antenatal times, but most importantly when they come to delivery and also after delivery. Our concern is regarding our pregnant women should begin to attend antenatal clinics. At the moment, it's running at about 28%, so we need to do better than this. And therefore, I'm appealing to all our 400,000 women who are pregnant at any point in Borno State to please come to our facilities for antenatal care. Also, we want our women in Borno State to deliver in our healthcare facilities. We have got 44 hospitals now, and also we have got over 300 primary healthcare services, and most of them conduct deliveries in these facilities. And very soon, we are also going to launch a special program with this in focus. This focus of safer bundle of birth care, where our women will be precious, who are pregnant will be precious, and that we don't want to lose a single life at the point of delivery or thereafter. And very soon we will have a program where there will be emergency transportation for pregnant women so that they quickly can reach our hospitals. And furthermore, the other third problem is when they arrive in the hospital may not be focused in terms of what to do immediately. So therefore, we are bringing up the standards in our hospitals through these trainings I've told you. We're going to bring up the standards of our blood transfusion services. We're going to bring up the laboratory services in the state so that our women do not die needlessly, especially because of what we call hemorrhage or blood loss after they've had a baby. Already His Excellency has commenced free maternal services, meaning the drugs that are used by our pregnant women during pregnancy are given to them free of charge. And also we have now introduced cesarean section free of charge. And furthermore, if a woman doesn't deliver on time because she couldn't make up her mind and then she ended up with obstructed labor, she may get what is called vesicovaginal fistula, which is an abnormal tract between the bladder and her birth canal, and therefore she will be leaking urine. Now we're providing, this is only curable by surgery. This VVF is called vesicovaginal fistula, and this is now also provided free of charge, courtesy of His Excellency Professor Babagana Umara Zulum, the Executive Governor of Borno State.
His Excellency has achieved so tremendously in the aspect of provision of medications to our population. Number one, he ensured that we have a free maternal health care where all pregnant women are taken care of in terms of their medications, even before delivery and after delivery. In fact, he provided medications even for post-surgical interventions, where the free maternal health care also take care of at least those basic medicines needed for the care of our pregnant women and our mothers to be.
Borno State government within the year under review has procured and distributed assorted drugs and medical equipment worth billions of naira to hospitals across the state, which are being given to the people free or at subsidized rate. The establishment of Borno State Drugs and Consumable Medicines Agency has gone a long way in proper distribution and utilization of drugs in the government-owned hospitals.
Now we are all aware the issue of drugs, essential drugs in our hospitals. Now the government has this year established the Borno State Drugs and Medical Consumable Agency in order to cater for the smooth distribution of essential drugs across our hospitals to the states. So now the management teams are on ground, the governing board also on ground. So now, just yesterday, the Honorable Commissioner and the ES, they were in the Lagos to sign an MOU with the manufacturers who can produce, supply essential drugs for us at the subsidized rates. So all these efforts are geared towards to the improvement of healthcare services in the states.
With the support of development partners, stable power supply in various hospitals across the state have greatly complemented the effort of Borno State government in providing affordable healthcare to the ordinary people.
We are coming out of the insurgency syndrome to developmental, and therefore the government of His Excellency Professor Babagana Umara Zulum has made adequate preparations in order that this development carries on. For example, we've been collaborating with our partners. Our partners, such as recently His Excellency did commission the emergency obstetric hospital, which was built by one of our partners called MSF Belgium. And it is a first-class facility which will receive all complicated cases within the metropolis, so that this will complement the work carried out in our general hospitals. We've also seen some of our partners who have constructed even new primary healthcare centers, such as in Monguno, were constructed by our partners. Our partners are also helping us to provide electricity in terms of solarization to some of our healthcare facilities. So that collaboration could only come in when there's ambience, which His Excellency has provided, that they can come and key in to the programs of the state and be able to carry out these changes that has happened.
Training and retraining of health personnel are essential in providing affordable healthcare delivery services. The Health Commissioner, Professor Baba Malam Gana, has in the last 1 year ensured that doctors, nurses and other healthcare providers have undergone various training to improve their knowledge and skills for effective and efficient service delivery.
These present administrations, particularly in the health sector, and with the able leadership of our Honorable Commissioner, Professor Baba Malangana. First of all, one of the achievements is building staff capacity. So when he came on board, most of the staff, more than 90%, has been trained and retrained. One of the achievements is training on clinical governance. Clinical governance is one of the measures now taken to govern the health facilities, where patients will be treated fairly. They have a hearsay, so all the health personnel will be responsible and accountable for what they are doing in the health facility. So this one is a great achievement and strengthening the health care system in the state.
His Excellency has already I think they have already started building a school of nursing in Monguno local government and in Goza, whereby 20 nurse educators will be deployed to these areas. And before deployment, these nurses, they have a criteria to meet before the deployment. So the Borno State government has already sponsored 20 nurses to go and have their masters in Bayero University, Kano, after graduation, then they will be deployed to these two schools of nursing. That is one. And the current commissioner has already ordered for another scholarship that nurses will go and obtain diploma or higher diploma in ophthalmic nursing, whereby our eye hospital here is lacking staff, and also His Excellency has already ordered for building of eye hospital in Biu local government and eye hospital in Monguno. So this 20 scholarship of staff will at least meet a lot of things. Or without these ophthalmic nurses, the hospital cannot even be able to function well. So the commissioner, with the aid of this commissioner, a lot of things has been done in the ministry, and a lot of things has been done to the sponsorship of these nurses, the educators, and then the ophthalmic nursing programs.
Give credit to whom is due. It is for this reason that the Health Commissioner Professor Baba Malamkana, the Permanent Secretary and some directors of the ministry poured encomiums on Governor Babagana Umara Zulum's exemplary qualities and unprecedented achievement recorded in the last 5 years, especially in the health sector.
His Excellency is erudite. His Excellency is a people's governor, because he's always thinking outside the box for what he can do to help the people of Borno State. And healthcare is one of them. No matter what you do, if you are not healthy, you cannot be productive. And therefore, it's important that, His Excellency is aiming at this at all the time. And moreover, prevention is better and cheaper than cure. And therefore, the immunizations that he's providing, the vaccines that are made available for the people of Borno State is number one priority for His Excellency. And also the fact that in some hard, difficult areas where accessibility is a problem, His Excellency has actually approved allowances for hospital staff, be it, nurses, midwives, or etc., doctors, about 30% in such security compromised areas, so that they can remain, and look after people of Borno State. So all this is happening because of the leadership qualities of His Excellency, Professor Babagana Umara Zulum. He's always been focused on health, and he's always visiting hospitals, and he's always meeting with the health team, so that we are all on the same page, and we take our matching orders from His Excellency all the time as to how to go higher in terms of provisions of services to the state. For that, we're extremely and immensely grateful to His Excellency Professor Babagana Umara Zulum for his attention on healthcare and his attention in looking after the people of Borno State, his attention that he wants to achieve universal healthcare coverage in Borno State.
No, honestly, the performance is immeasurable. With the leadership of our President Honorable Commissioner Professor Baba Malamkana, so who is 100% committed to deliver an effective and affordable and quality healthcare services to his people. Because, believe me, day and night, we at the Ministry of Health, we can't relent our efforts to see that, yes, we deliver the mandate and responsibility of this present administration toward the delivering of healthcare services to its people, as promised during this campaign promises. So I believe we at the leadership, we are committed, the leadership of the health sector, we are committed, And you can see so many professors in our agencies, especially the HMB, the Primary Care Development Agency, and other agencies. All those leadership, they are committed, and then we are now sit up to see that we delivered 100% services, healthcare services to our people.
Another very important thing I want to say again, His Excellency, towards September last year, signed into law the Borno State Drug and Medical Supply Agency. This is a game changer, and he has hit the ground running. An executive secretary has been appointed for the organization, and we are going to witness a revolution.
Just of recent, there is joint external evaluation. Joint external evaluation is like self-assessment of the state health sector. You evaluate yourself, an external team from federal government will come and assess. So how far are you with that evaluation? Just last week, they finished the evaluation in the state, which is part of international health regulations. Only few states in Nigeria have been evaluated, and now Borno State has joined them. So this one also is a great success.
Everybody knows that if you enter Maiduguri, you know that it has changed tremendously in terms of infrastructure. Some people that came after 10 or 15 years to Borno State, they testify that Borno State has changed tremendously. So, and they are saying the fact anywhere you go. And number two, in those days, by 6 o'clock, we are indoors. But now at least you can even go to wherever you want to go. By 9 o'clock, you can go there and come back successfully into your home.